Aliang, when you care for Grandpa, have you been observing and keeping a health record? Of course. I regularly weigh him and check his blood pressure. That's good. One time he ran a fever of 40 degrees Celsius. I was so worried I gave him fever-reducing drugs right away. Fever-reducing drugs? Don't give those on your own. Only give him medicine prescribed by a doctor. In the future, first manage the fever. If that doesn't work, then take him to the hospital for treatment. What should I do? There are a few main points that you should keep in mind. First, move Grandpa to the bed in a comfortable position to rest quietly and lower energy expenditure. Take his temperature every 2 to 4 hours and keep a record. If his temperature is above 38 degrees Celsius, wipe his body with warm water to help dissipate heat and use an ice pillow. When his temperature is over 39 degrees, only give him fever-reducing drugs on doctor's orders. Maintain air circulation indoors and turn on the AC or fan if needed. Provide high-protein, high-calorie, and easily digested food. Remember to drink lots of warm water. Don't forget to contact the doctor or home care nurse. And check Grandpa's skin, urine and stool, respiratory tract, and digestive tract for abnormalities. I understand. How do I help Grandpa dissipate heat with warm wipes and the ice pillow? Not yet. Let's see if you remember everything before we continue. Place him in a comfortable position to rest quietly and lower energy expenditure. Take and record his temperature every 2 to 4 hours. Wipe his body with warm water, use the ice pillow, and take fever-reducing drugs at doctor's orders. Maintain air circulation, eat high-protein, high-calorie, and easily digested foods. Drink lots of water. Check the skin, urine and stool, respiratory tract, and digestive tract. Now let's learn how to gently pat his body to dissipate heat. Wipe the body with warm water in a warm environment, like the bathroom or bedroom. Water temperature should be 41 to 43 degrees. Pat Grandpa's body with a wet washcloth. Remember to pat his back, arms, armpits, and groin area to increase skin blood flow and dissipate body heat. Aliang, cooling through patting is easy. Just remember the 2 rules and 2 steps. I'm sure you can do it. Yes, it's easy. The 2 rules are warm water and warm room. The 2 steps are wet the washcloth and pat gently. Next, I will show you how to use the ice pillow. Then it's your turn. Fill the ice pillow with ice, about 2/3 full, and add some cold water. Then secure it and place it in a plastic bag. Wrap it in a dry towel and place it under the head. Check the ice pillow every 2 to 3 hours to see if the ice has melted. Replace when necessary. That's not hard. Fill 2/3 with ice and add water. Secure it and place it in a plastic bag. Wrap in dry towel and put under head. Check the ice and replace when needed. Aliang, when you check Grandpa's temperature and he has a fever, you now know what to do. I understand. I won't give Grandpa fever-reducing drugs without doctor's orders. Good. Now I'll show you how to care for Grandpa's skin. Grandpa's skin care? Yes, Grandpa hasn't been feeling well. He lies in bed and doesn't move much. Yeah. If Grandpa is in bed for long periods, his skin remains in contact with the bed without shifting position. His blood circulation will worsen and cause bed sores. Oh, I see. I need to change his position. Yes, that's right. Keep a few things in mind when changing his position. Alternate positions roughly every 2 hours. Check and make sure his clothes, sheets, and padding is flat to avoid discomfort. Gently pat or massage the skin to improve blood circulation. Use neutral body wash and skin products daily. And wipe or wash the body with warm water. Keep the skin clean to boost skin resistance. Apply moisturizer like Vaseline to dry patches of skin. Check and keep dry his clothes, sheets, and diaper to prevent skin rash. Use breathable tape when necessary and alternate locations every day. Also, you need to watch Grandpa's food intake to prevent malnutrition or obesity. Wow, there's so many things to remember. Yes, Aliang, I think you're doing very well. You already notice many details. Learning a few more tips will help you much more. Thank you, Doctor. I think I can handle Grandpa's skincare. Home health care management includes keeping a record of respiration, blood pressure, body temperature, heart rate, and other details. This also includes blood sugar levels, joint activity, and changing wound dressing. These are all part of home health care observation and record keeping. If you have any questions, please refer to the videos produced by New Taipei City Labor Affairs Bureau and related booklets. I believe you will do a great job in health management. In the case of the patient's death, the foreign caregiver should urge the employer to apply to the Ministry of Labor within 30 days for change of care receiver in order to legally start a new contract with a new employer who is related to the new care receiver, or just apply to the Ministry of Labor for a change in employer or job.